Hey guys, happy Sunday. It's Amanda Brooks. I'm coming to you live from Bangor, Maine. This video has been prompted by one of my last videos on essential oils. There was an overwhelming amount of you that were very interested in learning more about essential oils. And because of that, I'm getting bombarded with private messages, which I love, but at the same time, I'm trying to provide all of you with some value. So I thought I would do a follow-up video on essential oils and teach you a little bit more. So I'm hoping that you guys are ready for this. So if you didn't see my last video, you are going to want to look at that because it talks about essential oil basics and how we can use essential oils, focusing on the 3 different ways in which we use oils: topically, aromatically, and orally. So take a look at that video if you haven't seen it, because I'm going to focus more on specific oils today, and I want to provide you guys with some information as to how to use the oils. Hey Jill, how are you? Okay, so here's the deal. Probably 6 years ago, I knew nothing about essential oils. For those of you who have been following me, you know that I was trained by the medical model and I'm a physician assistant, and honestly, I wanted nothing to do with alternative health. Lucky for me, my mom, Kathy, she is super into alternative health, so she just kept at me to take a look at essential oils, and so I'm so glad that I did. Now, I have here 3 references that I think would be very helpful, and I will link the references in the comments below after I finish the video. You don't necessarily need to know everything, right, in life. You just need to know where to find it. So I found these extremely helpful, and you won't know how to use the oils that well until you start using them. So if they're sitting on a shelf in their bottles in your house, just get them out and start using them. So the first book, everything's backwards, it's called Essentials of the Earth, and I love this because you can look up a specific ailment and then it will give you recommendations as to what oils to use. So this is very, very awesome. It's geared towards doTERRA oils specifically, but you can use it with other therapeutic grade oils as well. Just want to be really clear that I'm talking about certified pure therapeutic grade oils on every video that I do. So if you are using this book, it will talk about specific blends, and that gets kind of confusing at times because the blends aren't the same as the doTERRA trade name. So if you're confused, just Google the oil blend specifically and doTERRA. So tension blend and doTERRA, and you'll see what the oil blend is. So that's the first book. The other book is, those of you who are pregnant out there, you're always asking me if you're able to use essential oils when you're pregnant. Yes, absolutely. But again, this book, Essential Oils for Pregnancy, Birth, Babies, it's great. Because remember, essential oils, what do? They give our body what they need to heal themselves. So if you didn't see my last video, I firmly believe there are 4 products that we need to build our foundational health, and then essential oils, they're more like the fine-tuning mechanisms. So they're really great. So that's the next book. And then the third book, I'm not huge into animals. I'm not a veterinarian. I'm not a trained veterinarian, but I do have a cat. And a lot of you are messaging in and you're asking if you can use essential oils with your pets because you're reading that they are scary, that they're not good for your pets. Now, again, a lot of this hype that we read on the internet, we have to take it at face value. So a lot of it pertains to oils that are adulterated. So oils that contain other fillers, to fill up the bottle and make a product. So this is the next book. It's called Spoil. I love that. Spoil Your Pet, and it's written by a DVM, a veterinarian. There are certain oils that you definitely want to stay away from with pets. Melaleuca, tea tree oil, and some of the mints like wintergreen. Those are some things that you can learn about in here. You also have to remember that pets, they age 7 times faster than we do, hence dog years. So you definitely want to be providing your pet with a strong foundation of health like you do yourself. And again, if you saw my last video, you would have learned a little bit about Nerve2 activation, and pets, especially dogs, need that hands down. So those are the references, and I'll put those in the comments below. And bear with me because this video, it's going to be a little bit longer because I'm going to go into specific oils and what you can use them for. Remember, each essential oil, it contains several hundred different compounds, and each of those compounds has a different medicinal effect. So sometimes people, they're wondering what oils they specifically need. Now, I'm going to go over probably 10 or so oils that you guys should all have in your medicine cabinet. If you do, you can pretty much treat anything. I don't like to make disease health claims with these products because they're not approved by the Food and Drug Administration, so don't get me in trouble. But I also have a device. It's called the Itovi device. It uses a technology called bioimpedance, and what that Hey guys, sorry, phone call. I don't know how to stop those from coming in, but it tests to see what oils work best for you. So not sure where you're watching this from, but if you are in the greater Bangor area, just privately message me. If I'm in my office, this literally, it takes 30 seconds. Come on in. The more that can use it, the merrier. It was an expensive device, so I can scan you specifically to see what oils. But over the last few years, I've actually developed a few different PowerPoints that I've given different hospitals when talking about the importance of using essential oils. And I thought about sharing this PowerPoint with you. Unfortunately, don't know how to put it up on my screen. So I have it right here next to me. And so I'm going to go through the PowerPoint today, and hopefully you guys will find it effective and helpful. So get out a piece of paper, get out your pen or paper, because you're probably going to need to start frantically taking some notes. And I was inspired by this to do this last night because I was working in the ER. We were super busy, and one of my colleagues, he's like, hey Amanda, he always asks me when he doesn't know what to do, like for simple patients. He's like, got this patient with a sore throat, you know, like what can I do? And we were talking about different essential oils to treat a sore throat. And so it kind of inspired me to do this. So I hope you find it helpful. So lavender is the first oil I want to talk to you guys about. It's probably the most versatile of all the oils. So if you don't know where to begin, probably begin by using this. It's calming. It is used oftentimes for insomnia because it actually stimulates the pineal gland, which is what produces melatonin. It's really great for skin and skin issues. People that sustain burns, minor burns, cuts, abrasions, applying lavender essential oil, typically diluted in a carrier oil like coconut or olive or jojoba, works exceptionally well. I remember working in the emergency department, had a patient with a really bad palmar burn, so to the palm of his dominant hand, and sadly he didn't have health insurance. I knew he wasn't going to follow up with a plastic surgeon, so I'd made the recommendation to find or to start utilizing this. He found me on Facebook, sent me before and after pictures, and they were just amazing. So remember that essential oils, they're antimicrobial, so helps to fight off infection, but they also provide some pain control as well. So lavender, it's great. It's a great antihistamine. I also remember having a patient come in with diffuse urticaria, so diffuse hives, and it was an older person, which older people don't metabolize pharmaceuticals as well as young people. So I asked if he'd be open to trying a topical application of lavender, and oh my gosh, his hives, they went away very quickly. Other studies looking at lavender are with depression, anxiety. There have been published studies looking specifically at diffusing lavender essential oil in doctors' offices, but more specifically dentists' office. People always get scared by that drill, I think. And actually my dentist diffuses essential oils in his office, not always lavender, but a lot of things like lemongrass, wild orange to kind of uplift mood and take that medicinal smell out of things. So the next oil I want to talk about is lemon. I love lemon. Lemon is nice just to put in water. It works as a detoxifying agent. It's great to cook with. So for those of you who don't always have a basket of lemons, you can add this to any kind of dressing that you're creating or dip. my aunt makes these amazing sugar cookies, and she adds a few drops of lemon, and they are phenomenal. So a 15 milliliter bottle, which I don't have the lemon right here with me, but it's about this size, contains about 45 lemons. So that's a lot of concentrated lemon in one bottle. What really got to me with the lemon is this. My cat, Indy, he loves marshmallow, but he really loves Peeps, those like sugar-coated marshmallows. And the Peep got ground into my carpet, right? Like Arabella walking all over it, who knows? And I was distraught as to how I would get that out. But lemon essential oil is great for a nature's Goo Gone. So applying the essential oil directly to the stain, and then just using a warm rag to get the stain out. So oh my gosh, I've gotten out blood out of things, dirt, grease. This typically wins men over because men are skeptics. Men seem to be more skeptical about essential oils than females. So have them get grease all over something and then use lemon essential oil for this. But it's also great for people that have the mucus crud in their throat, right? Helps to kind of break up mucus. It's a great anti-inflammatory, great cleaning agent. So if you buy like a 6-ounce glass spray bottle off Amazon, and if you put like 20 to 30 drops of lemon essential oil, fill the bottle with water, great for windows, surface cleaner. I was a little bit hesitant to use it because I'd always used Windex way back when. This, oh my gosh, hands down, smells great. You can have your kids help you because you don't care if they're lapping up the countertop that they're cleaning because it's just lemon and water. So this works really well. Add a little bit of vinegar and you have even a stronger cleaning agent. So there was a study specifically looking at lemon essential oil used in an irrigation for a nasal irrigation for allergies. Because lemon is also a great way to treat allergies. They looked specifically at mast cells. Mast cells degranulate and release something called histamine. So histamine gives you the watery eyes, the runny nose, the sneezing. That's why a lot of people over the counter take an antihistamine like Benadryl. But this works really well. So in this study, they looked at people and asked them what their allergic symptoms were, grade them from a 1 to a 3. Everyone was on the spectrum somewhere. And after using this lemon essential oil in a nasal irrigation for 30 days, all of the allergy symptoms had subsided. So super powerful. The next oil, I think it's the third oil we're going to talk about, is peppermint. Peppermint is kind of what really interested me in essential oils. Like I told you, I was extremely skeptical. So for all of you skeptics out there, there is hope. But I had a bit of a tension headache, and so I just put a drop of the peppermint essential oil on my fingers like this, and I rubbed it into my temples and back into my parietal area, and then rubbed the residual on the back of my neck. And within I would say minutes, my headache was gone. So peppermint, 1 drop, more is not better, like I've said before. 1 drop is the equivalent to about 28 cups of peppermint herbal tea. So it's a great way to help the body cool down. So with fever, remember fever's good. It's the body's way of fighting off disease and illness. But it's great for headaches. I use this all the time on patients. So hydrating yourself for a headache, treating nausea, maybe giving an anti-inflammatory, but applying this topically works wonders. A lot of times people treat headaches with Tylenol. Tylenol is the #1 source of liver toxicity. I think there have been like several 100 recalls on products containing Tylenol, specifically children's products. They actually looked at a study with individuals suffering from headaches and treated the individuals with one group with Tylenol, one group with peppermint essential oil, and the outcome, the resolution of the headache was the same. So I just say that because if we can just try using something natural first, why not, right? Because essential oils, they are absorbed like food products. So back to peppermint. Another great way to use peppermint is for bowel inflammation. So for people suffering from irritable bowel disease like IBS, Crohn's, colitis, this works wonders, and it works better than anything over the counter because, again, it's therapeutic grade. So pharmaceutical companies, they're always after something that's going to make them money. Okay, so if you look over the counter, I think there's one called Guard. Essentially what it is synthetic peppermint. So they're just trying to use an essential oil and charge a lot of money for it. So again, I think 80% of pharmaceuticals are derived from botanicals. So helps with circulation, allergies. So the three big oils that I really think of for allergies are lemon, lavender, and peppermint. And if you combine the three in a diffuser or in like a vegetable capsule and take this orally, it's awesome. The next oil that I want to talk about is Melaleuca. You guys might know this as tea tree oil. So this works awesome with fungal infections. So if you have those fungal toenails and you've just been really hesitant to start yourself on something like Lamisil because it's toxic to your liver, or you're just so sick of them, then try applying Melaleuca consistently daily. Now, it's not going to happen overnight that your toenails are miraculously fungus free, but if you are diligent with this, several months to a year, you should definitely see a change. This is great for diaper rash. There's oftentimes a fungal component to diaper rash. Melaleuca, frankincense, lavender together in a spray with fractionated coconut oil works amazing. It's only February, but pretty soon we'll be coming into the summer season with mosquitoes and mosquito bites. Applying a drop of Melaleuca and maybe even lavender to the bite helps to alleviate the itching and prevent infection. Other skin conditions like eczema, psoriasis, this is definitely something that I want to have so that I can use personally, but I can also recommend to others. Melaleuca also has a very strong antimicrobial effect, so very strong against bacteria and viruses. The next oil is oregano. This is a heavy hitter. So this is we're in the thick of flu season. I think I saw like 5 people that tested positive for influenza A last night. So I'm really glad I have oregano. I know my mom, she puts it on the bottom of her feet every night before bed. Remember, the bottom of the foot's the most porous area in the body, so this is where you want to put oils if you don't know where to put them and you want them to reach every cell in your body. But oregano, it naturally just stimulates an immune response. It's a great heavy hitter for an antimicrobial. It's pretty much like a medicine cabinet in a bottle. Before I elaborate more on that, it's great for warts and tag moles. So remember, more is not better. So this is a hot oil. In other words, if you just apply it to your skin, you might kind of experience a burning effect. There's been only one issue where I've recommended essential oils to a patient and we had a bad outcome. And it was with the use of oregano. So she had a tag mole and she applied the oregano directly, or what we call neat, so without a carrier oil. And then she put a Band-Aid, which is an adhesive, over it. So the oregano ate through the adhesive and then kind of formed an ulcer on her skin. So just remember that you need to definitely be responsible and know what you're doing when you're using essential oils. So if you're going to try treating a wart or a tag mole, you'll probably want to use a carrier oil with this. Like I was saying, oregano is awesome for treating bacteria, and Georgetown University, they actually found that oil of oregano appears to reduce infections as well as traditional antibiotics. And they actually compared oregano essential oil to antibiotics like penicillin. Penicillin is an antibiotic that we use to treat strep throat. They also compared it to vancomycin. Vancomycin is like a big dog. It's used to treat methicillin-resistant Staph aureus, MRSA. You've heard of that superbug. So it's the real deal. And Georgetown also went on to say that you cannot develop resistance against essential oils like you can traditional antibiotics. So antibiotics are usually composed of just a few compounds. So it's really easy for bacteria to outsmart these. You know, they just mutate, which is why then we need to use stronger antibiotics. But essential oils, each batch that we harvest has a different chemical makeup. And I'm sounding like I'm on repeat, but it's just as a teaching mode. Remember, each essential oil has several to several hundred different compounds. So frankincense, that's another oil that I think everyone should have. It's kind of the holy oil, right? It's harvested from the frankincense tree. Again, you want to make sure that you are using a therapeutic grade oil. In other words, that your frankincense is harvested from somewhere like over in Saudi Arabia, Oman, you know, somewhere over there, right? There is a chemical constituent in frankincense called, they're called sesquiterpenes, and these allow frankincense to actually cross the blood-brain barrier. This is important because it allows it to enter the limbic system. This is like where our emotional, like our feel-good system is located. So frankincense, it's great for all of us because it helps with depression. And right now, many people are suffering, unfortunately, from seasonal depression. So frankincense, it's also great to support the thyroid. It's great for like neurodegenerative disorders like Parkinson's, MS, Huntington's. There's also a huge anti-inflammatory component with frankincense. So people, we know that most disease stems from inflammation, and this is a great way to kind of support your body additionally, like if you have arthritis or any other inflammatory condition. But what's really neat about frankincense, what the pharmaceutical companies are really like honing in on, is the fact that frankincense has the ability to inhibit cancer cells. Actually has the ability to stimulate something called apoptosis, which is programmed cell death. Now, this is phenomenal. So you can look at several to several hundred, actually several thousand research studies specifically looking at frankincense in different cancers. There's a lot of GYN cancers that have been specifically studied with frankincense, like breast, ovarian, uterine, bladder cancer. I just was looking at a study specifically looking at pancreatic. Yes. So those are kind of some oils, some little tips on oils. There are a few oil blends that specifically doTERRA puts out that I love. One of them that I wanted to talk about is Deep Blue. This contains something called helichrysum. Helichrysum actually works on all of the inflammatory pathways, so I love this for pain. Use it all the time on patients coming in with pain, especially elderly patients, because I know it's not going to interfere with other medications that they're taking. So this is something that you can apply topically. It comes in the form of an oil as well as a lotion. I love the lotion because you can apply a pea-sized amount, rub it in vigorously, and repeat it as needed. So it works so well. The other blend that I wanted to talk about is Breathe. Breathe is a respiratory blend, so helps with people that are coughing up a storm. Actually helps with snoring, so putting this on the bottom of your feet, rubbing the residual across your chest, having the oil on your hands and just cupping them over your nose and mouth. It's kind of a way to self-diffuse, which works really well, and of course stick it in your diffuser. Works great for kids with croup, coughs, asthmatics, COPD. Anyway, funny story, a woman that had COPD, she's like, yeah, I can't get near all this stuff. Like, all these smells are gonna make my COPD just go off the walls. And she's used to synthetic smells. So synthetic smells absolutely affect breathing disorders that are inflammatory, like COPD and asthma. It's because they're synthetic, but these are natural. And so it was funny because she started like smelling the Breathe, and then she went on to every single other oil in my kit, and she walked away feeling like $1 million, and she just couldn't believe it. So the other oil is Digestin. This is great. It's a digestive blend. And again, these essential oils give your body what it needs to do what it needs to do. So great for both constipation and diarrhea. So applying this topically to the abdomen bottom of the feet, a drop in water. There's several other products that you can purchase using this. Again, I'm not a distributor for this company, but I know locally, I believe Tiller and Rye does sell doTERRA, and pretty much everyone has a doTERRA account, so ask your friend if they can order these things for you. The reason why I really like to talk about Digest then is because pretty much everyone is on a PPI, so a proton pump inhibitor or an H2 blocker. You guys, these are not benign drugs. These drugs are used for acid reflux, and the FDA endorses them for 14 days at a time, no more than 3 times a year. And people are on them indefinitely, and then they stay on them. And guess what? These drugs can lead to fractures. So they're just definitely not benign. No pharmaceutical drug is. And again, it treats a symptom instead of treating an underlying cause. And then the last blend that I want to talk about that I'm really passionate about, especially since I work in the emergency department and I've been surrounded by influenza for the last several months, is Onguard. So Onguard, this actually is a great antimicrobial as well, but there have been studies specifically looking at Onguard. Onguard is effective against influenza. It actually inhibits the, prevents replication of the virus at the endoplasmic reticulum. So it's effective against influenza, so I definitely diffuse this in my house. I take this orally and I use it topically. And it's also effective against that superbug that everyone's heard about, is MRSA. So there's a microbiologist, her name's Nicole Stevens. She actually did some research looking specifically at a heavily diluted solution with Onguard, which means, hey, listen, she put some water in a spray bottle, added a few drops of Onguard, and it was effective against killing MRSA. So anyway, these are just a few little tips about how you can use essential oils, what they're good for. Hope you guys have found it helpful. I know I talk fast, so I was trying to get through a lot of information quickly, but I'm hoping this is going to help you. And if you're just tuning in, remember to watch the beginning of this, because I did share the resources that I think you need to effectively use essential oils. And please, please, oh please, share this with others so that they know where to get the information, because you can teach yourself anything about anything. I'm definitely a self-taught essential oil person. So anyway, hope you guys are having a great Sunday. It's snowing here, so it's beautiful. But so much love is being sent to all of you, and I appreciate all your support. Take care.